The American healthcare system isn't broken, it's working exactly as it was designed. And that design has one purpose: transfer wealth from middle-class families to corporate shareholders permanently. Medical bills are now the #1 cause of bankruptcy in America, affecting over 500,000 families every single year. But here's what they don't tell you. Most of those people had health insurance when they got sick. Let me introduce you to Michael, a 42-year-old middle manager making $75,000 a year with good employer-provided health insurance. He pays $450 per month in premiums, has a $6,000 deductible, and thinks he's covered if something bad happens. In March, Michael has a heart attack and gets rushed to the emergency room for life-saving treatment. 3 weeks later, he receives a bill for $127,000, and his insurance company says they'll cover $89,000 of it. That leaves Michael responsible for $38,000 in medical debt, which is more than half his annual take-home pay. But the nightmare is just beginning, because the bill breakdown reveals how the system is designed to bankrupt you. The hospital charged $1,500 for a single bag of saline, salt water that costs $1 to manufacture. They charge $75 for each Tylenol pill, $3,000 for facility fees that nobody can explain, and $18,000 for tests that took 20 minutes. Here's the part that breaks people. These aren't mistakes or accidents. This is the system working as designed. Hospitals charge whatever they want because there's no price transparency and patients can't shop around while dying. Now let's compare this to literally any other developed country on Earth. In Germany, that same heart attack treatment costs $8,000 total, with the patient paying zero out of pocket. In Japan, it costs $12,000 in total, and the patient's maximum annual healthcare expenses cap at $2,500 no matter what happens. In Canada, it costs $6,500 total, and the patient pays nothing because it's covered by their taxes. Americans pay more for healthcare than any country in the world, twice as much as most European nations per person. But we rank 37th in healthcare outcomes, meaning we're paying premium prices for mediocre results and financial devastation.
So where does all that money go if it's not creating better health outcomes? It goes to insurance company profits, pharmaceutical company shareholders, and hospital corporation executive bonuses.
The top 10 health insurance CEOs in America made a combined $342 million in compensation last year. That money came directly from premiums paid by families like Michael's, who then got bankrupted by medical bills anyway.
Here's how the wealth transfer trap works. You pay premiums every month whether you use healthcare or not. Then when you actually need care, you still pay thousands out of pocket through deductibles, co-pays, and out-of-network charges.
But even if you do everything right, stay in network, get pre-authorization, follow all the rules, they can still deny your claims. Insurance companies deny 1 in 5 claims on average, forcing patients to either pay out of pocket or fight for months while debt collectors call.
Let's talk about the deductible trap that most Americans don't understand until it's too late. Michael's $6,000 deductible means he has to spend $6,000 of his own money before insurance pays anything at all.
So he's paying $5,400 per year in premiums plus up to $6,000 in deductibles. That's $11,400 in healthcare costs before insurance covers a single dollar. And that's considered good insurance in America, which tells you everything about how broken the system is. Now here's where it gets even more insidious. Even after you hit your deductible, you're still not fully covered. You pay coinsurance, which means you cover 20-30% of every bill even after the deductible until you hit your out-of-pocket maximum.
Michael's out-of-pocket maximum is $14,000 per year, meaning he could pay $9,400 in 1 year and still not be fully protected. A middle-class family earning $75,000 is supposed to absorb a $19,400 healthcare expense and not go bankrupt? That's the design.
But wait, there's another layer to this trap. Out-of-network charges don't count toward your deductible or maximum. So if the anesthesiologist during Michael's surgery wasn't in network, even though he had no choice, and then after person responsibility with no limit.
This is called surprise billing, and it's completely legal in most states because the healthcare lobby made sure it stayed that way. Families get hit with $50,000 plus bills for out-of-network care they never consented to and had no way to avoid during emergency.
Now let's talk about prescription drugs, where the wealth extraction becomes almost comical if it wasn't destroying lives. Insulin costs $5.10 to manufacture and sells for $300 plus per vial in America, while Canadians pay $30 for the exact same product. Americans are literally dying because they ration insulin they can't afford, while pharmaceutical companies post record profits every quarter. The system is designed to prioritize shareholder returns over human lives, and it's working perfectly for the people who designed it. So what's the financial impact of this system on the average American family over a lifetime? A middle-class couple will pay approximately $1.2 million in healthcare costs between premiums, deductibles, and out-of-pocket expenses from age 25 to 65.
That's $1.2 million that could have been invested, saved for retirement, or used to build generational wealth. Instead, it gets transferred to insurance companies and healthcare corporations, leaving families financially vulnerable their entire lives.
Here's the cruel irony. Countries with universal healthcare systems spend less per person and have better health outcomes. The profit-driven American model is simultaneously more expensive and less effective, but it's incredibly profitable for the right people. So what can you actually do to protect yourself from this wealth extraction system? First, build a dedicated medical emergency fund separate from your regular emergency fund. Aim for at least $15,000.
Second, always ask for itemized bills and dispute every charge that seems unreasonable, because hospitals expect you to just pay without questioning. Third, negotiate aggressive and ethical debt. But here's the reality. Individual tactics can only protect you so much when the entire system is designed against you. The only real solution is systemic change, which requires Americans to understand they're being bankrupted by design, not by accident.
Medical bankruptcy isn't a personal failure, it's a feature of a system that extracts maximum wealth from the middle class. Once you see it for what it is, you can't unsee it, and that awareness is the first step toward demanding something better.